Good afternoon. Thanks again for joining us. As usual, I will give you a report on the latest statistics. The total number of positive cases reported yesterday was 830. That represents 4% of the total number of tests that were conducted and means that the overall number of confirmed cases is now 189,175. 243 of the new cases were in Greater Glasgow and Clyde, 145 in Lanarkshire and 116 in Ayrshire and Arran. The remaining cases were across 10 other health board areas. 1,499 people are currently in hospital, which is 43 fewer than yesterday. And significantly, that means that the number of COVID patients in hospital is now back below the peak of last spring, which is another wee ray of sunshine for us to feel positive about today. 109 people are in intensive care who have tested positive for COVID or been admitted to hospital with COVID within the past 28 days, and that is 4 fewer than yesterday. You might recall I said yesterday that we would, from now on, be reporting another statistic every day in relation to ICU, and that is the number of what we are calling long-stay COVID patients, people who have been in ICU for a period of longer than 28 days. And as of today, there are 28 of those, and that is 2 fewer than the situation I reported yesterday. I am sorry, though, to report that 48 additional deaths have been registered in the past 24 hours of patients who first tested positive in the previous 28 days. And that means that the total number of deaths under this daily measurement is now 6,599. Once again, I send my deepest condolences to everyone who has lost a loved one. Now, as you can see, I'm joined today by Deputy Chief Medical Officer Dr. Nicola Steedman, who will help me answer questions in a few moments. Before then, though, there are just 3 things I want to update you on. The first is that later today, as is normal on a Thursday, we will publish the latest estimate of the R number, and that will show that the R number in Scotland remains below 1. That of course, is reflected in the decline we're now seeing in case numbers, in test positivity. I will repeat my caution against looking too closely at individual days, but the 4% test positivity reported today is the lowest we've seen in quite some time. And also, of course, the decline in hospital admissions, which has taken the level of hospital patients below the peak of last spring. All of that is really good news. The rays of sunshine that I spoke about last week undoubtedly are a wee bit brighter this week, but it is nevertheless important for me to continue to stress that the situation, especially in face of the new, more infectious variant, which now accounts for about 3/4 of all new cases in Scotland, that situation remains precarious, and so it demands still from all of us continued caution, the utmost caution indeed. However, the sacrifices everyone is making, and unfortunately the sacrifices we need to continue to make, are slowing the virus down. Lockdown is working. To ultimately win the race, though, we need also to get people vaccinated as quickly as we can. So the second thing I want to do today is give you an update on the vaccination programme. Obviously, the bad weather has been a real concern for us this week. However, as of 8:30 this morning, I can tell you that 1,048,747, I'll say that again, 1,048,747 people in Scotland have now received their first dose of the vaccine. That is an increase of 63,178 since yesterday. And that actually is yet another record. It's the highest daily total that has been achieved so far. And when you think about the truly dreadful weather that most of the country is experiencing right now, which means that many of those administering and receiving the JAGs will have had to brave extreme elements, deep snow, to get to vaccination centres, I don't think it's an exaggeration to describe this as a heroic achievement. And the fact that more than 1 million people have now received the first dose of the vaccine is highly significant. It means that we have now vaccinated more than 23% of the adult population, And even more importantly, most of them are in the groups that we know are most vulnerable to becoming seriously ill or dying from COVID. So it's that gives us real hope that even if we don't see the vaccine having an immediate significant impact on transmission of the virus, we will start to see it reduce serious illness and deaths. So I am immensely grateful and I will be eternally grateful to everyone who is helping to deliver this programme in the most difficult of circumstances, and of course to everybody who is turning up in such huge numbers to receive the first dose. Now, just to complete today's report, in terms of the breakdown of the headline figure, I can tell you that first doses have now been administered to 99.9% of residents in older people's care homes. At least 97% of over 80-year-olds living in the community have also had a first dose, and so too have 87% of 75 to 79-year-olds in the community and 54% of 70 to 74-year-olds. So we remain on course to give first doses to everybody over 70 and everybody with a serious clinical vulnerability by the middle of February. And by that date, many in the 65 to 69-year-old age group will also have had the first dose of the vaccine. So this is all really positive news, particularly the uptake figures. People are coming forward for this vaccine in numbers that I could not have dared hope for. In my wildest dreams, I would have hoped for it, but I would have been very sceptical about our ability to achieve the kind of uptake numbers that I've reported today. So that is down to the appetite and the willingness of everybody in these groups across the country to come together for their individual protection, but also to play their part in our collective fight against this virus. So again, my heartfelt thanks to everybody. I don't want to take away from that, because that is unalloyed positive news with what I'm about to say next, but I do feel the need to repeat the note of caution that I sounded earlier in the week about our expectations as things stand just now for the weeks immediately after mid-February. By Sunday, I can tell you that we expect to have given the first dose to 75,000 more people than we originally anticipated in the deployment plan that we published some weeks back. Now, that's good news, because that is due to the higher take-up rates of the vaccine than we had anticipated. But in addition to that, we have also received slightly lower stocks of the vaccine than we expected back then, due to a temporary reduction in Pfizer's manufacturing capacity. So these two factors, combined with the need to preserve some stocks for second doses starting to get underway, mean that we have to ensure in the next few weeks that we don't schedule more appointments than our vaccine supplies allow. So we might need to reduce the number of appointments that we can schedule over the next few weeks. But if vaccine supplies increase again more quickly than we expect, we will very rapidly be able to accelerate the programme once again. Now, I want to stress that this kind of issue is not unexpected, given the huge scale of and the complexities associated with a vaccination programme like this. And importantly, we remain on course to meet the key targets that we have set out. Crucially, that immediate target for the middle of February, and slightly longer term, we still anticipate, subject to the supplies being broadly as we expect, that everyone over the age of 50 will have received their first dose by early May, together with those who have underlying health conditions. So any reduction in appointments in the next few weeks will need to be seen in that context. However, the possibility of a reduction below the kind of daily figures we're seeing right now, and it is beyond our control, is something that we should be aware of when we're reporting on figures over the next few weeks. And I think it's important for us to set out quite clearly, or as clearly as we can, what our expectations are going forward. Ultimately, everybody will get vaccinated. The phasing of that depends, of course, on supplies, uptake and the need to get second doses to people. So there's lots of people working hard to make sure we get this modelling and all of the assumptions behind that right. But for now, I think we can all take some satisfaction from knowing that we have a vaccination programme, our biggest tool right now in the ultimate fight against this virus, going really well, and people across the country are coming forward in large numbers to take it up. So again, thank you to everybody involved in that. Now, the third and final thing I want to touch on today is just to highlight some improvements that have been made to the Protect Scotland app. This, remember, is the app that I hope most of you already have on your phones, which allows you to enter in a code if you test positive for COVID. The app then automatically alerts any other app users who've been in close contact with you at the time that you might have been infectious to tell them that they need to self-isolate. The app has already been really valuable. It's told so far almost 40,000 people to self-isolate, and of course many of these people would otherwise have been notified maybe hours later or even a day later, or perhaps not notified at all, because where the app is especially useful is in notifying people who've been in close contact with each other but they don't know each other. We want to continue to build on and improve the app. So the two improvements that I'm about to talk about are operational from today. Firstly, if you're told to self-isolate through the app, from today you can download a certificate on your phone, and that certificate can then be used as proof when you're claiming self-isolation support or when you're contacting your employer. Previously, it was only possible to provide a screenshot of your notification, and this was not always being accepted as proof. The second improvement is more technical, and it deals with an issue that I know has been a source of frustration to some people. The app uses an exposure notification system which didn't work on some older phones. In particular for iPhones, the 5S and 6 models couldn't use the app. More recent models from 6S onwards have always been able to use the app. But Apple has now made changes, which means that if you have an iPhone 5S or an iPhone 6, the app will now work. And of course, that means a wider range of phones can be used. The app's already been downloaded 1.8 million times, but we want to increase its reach further. So for those of you who have the app already, please check in your App Store or Play Store to make sure it's up to date and you have all of the recent improvements. And if you have an older iPhone and so when you first tried to download it, you found it wasn't possible, please have another go now because it very possibly is open to you now. The app takes just a couple of minutes to download. It's easy, it's quick, but it can play a really valuable role in helping us to defeat the virus. Now, the app, of course, is one of the ways in which we're trying to get and keep COVID under control. In the past week, we've also announced plans to expand the availability of testing and, of course, implement tighter travel restrictions for people coming into Scotland. Both of these measures will be important in helping us to suppress COVID. And, of course, as I've already covered at some length, the vaccination programme is going really well. All of that should give all of us some real cause for optimism right now. What it must not do is give us any grounds for complacency. And this is perhaps the most difficult bit of what I need to say, because when we see everything going in the right direction, I understand that the questions we all have about why we need to continue to live under these restrictions get louder and louder in our heads. But right now, it is vital, if we are to keep the virus under control and to keep these things going in the right direction, that we do continue to stick to these rules and regulations. So please, for now, stay at home except for essential purposes like caring, responsibilities, essential exercise or essential shopping. Outdoors, please don't meet more than one other person from one other household. Continue to work from home if you can. And employers, please remember you have a legal duty to support people to work from home. And as you have just heard, please download the Protect Scotland app if you haven't already done so. On any occasion when you do go out, remember facts, face coverings, avoid crowded places, clean hands and surfaces, use 2 metres distancing and self-isolate and get tested if you have symptoms. Above all else, though, please for now continue to stay at home as much as possible. We know that is working. We can see it in the numbers, so we have to stick with it while the vaccination programme continues to do its work. So please stay at home, protect the NHS and continue to help us all to save lives. Thank you very much indeed for your patience in bearing with me as I went through all of that. We're now going to go to questions, and Dr. Steedman will help me with the questions. And first up today is Louise Scott from STV.
Thank you, First Minister. Just to pick up on the points there about the over 70s and 54% of those as you were saying, between 70 and 74 being vaccinated. We're still hearing from people in this over 70s category who haven't received their appointment yet. One, when they phoned up, was told that their GP practice had run out of vaccines, and they said that this morning they were told it'd be a few weeks until they received it because of this. And the other, in a different local authority area, was told that they haven't reached them yet on the list, with only a few days to go to reach that target, which of course includes a weekend where vaccine numbers usually dips. Will we definitely complete that category in all areas? And are there any areas of the country where they're potentially facing more difficulties in delivering this?
Well, I think you can do the arithmetic for yourself and see the daily rate of vaccination right now, the numbers that we still have to do in these categories, and we can share some of the numbers as opposed to the percentages with you if you need that later on, that we are firmly on track to do this. The comment about vaccination rates dipping at the weekend, that has been a Sunday issue. So Saturday last week was actually a record high number, 52,000 from memory. Obviously, we've had higher numbers since then, but at the time that was a record high. And even although we saw it go down on Sunday last weekend, the figure last Sunday, Sunday just passed, was 3 times higher than the Sunday before. So, we are achieving a daily rate of vaccination that means that we are firmly on track. If you'd asked me, as many of you were asking me about this earlier in the week, particularly at the weekend, I was extremely worried that the impact of the weather would really slow us down this week, and that this target may be challenging to meet. But as we've seen over the last few days, and this is, I used the word heroic earlier on, and I think it is a heroic effort on the part of people going to vaccination centres, either to give the vaccine or to get it. We've seen not a slowing down, but an acceleration. So I'm confident we're on track to meet that. Yes, in any target, will there be 100% of people? There may be people that, for a variety of different reasons, are still to be done when we reach that date. In any massive programme, you're going to get that, but we will be working really hard to minimise that and overall to meet that target. So if you're in the position that you are over 70, now there will be a number of over 70s that haven't been vaccinated yet, because they will be vaccinated over the next few days. If you haven't received your appointment, as I've said before, if you're not getting the information you need from your GP or from the helpline, as a last resort, and I repeat, as a last resort, email my office, First Minister @gov.scot, so that we can try and find out. I know it's really hard because I think everybody, I include myself in this, we're all desperate to get this vaccine. So I know it's really hard to hear me say be patient. But I do say that we are getting through everybody, and we will get through everybody. But if you're really worried and frustrated, you've got routes to try to get some reassurance, but we will reach everybody. Again, in a programme of this scale, and I've tried to be candid about this, we'll see glitches, we'll see things just not working every day as we want them to. We had some really difficult circumstances in Fife earlier this week where people had really bad experiences, and there's been apologies rightly given for that. And I'm not trying to excuse these things. I'm just trying to, I suppose, be realistic that this is, and this is not politician speak of hyperbole you usually hear from politicians. This is the biggest peacetime logistical challenge our country has ever undertaken. It stands to reason things sometimes will not go as well as we want, but overall, this programme is going far better than I dared hope it would go, and that's a tribute to everybody administering it and everybody who's taken up the opportunity to get vaccinated. So let's keep going and resolve the problems and the issues and the people who feel they've been left behind along the way. Let's resolve these as we go. Everybody who's eligible is going to get vaccinated, and that is what we're absolutely focused on ensuring happens. Andrew Anderson from the BBC.
Yes, thank you, First Minister. Could I ask you about the hotel quarantine rules that come into force on Monday? The Scottish Government is taking a stricter approach on this as to who will have to quarantine compared to the UK government. Is that something that you continue to be in discussion with the UK government? And are you considering border checks on travellers who enter the UK through an English airport or port who are then travelling on to Scotland?
So we have taken the decision, and I think the decision we have taken, and I can only speak for our decisions, is more in line with the scientific advice because of the way we've done it than it would have been if we'd taken a more restricted approach, which is that from Monday, anybody coming into Scotland, regardless of the country they're coming from, will have to, apart from some of the sectoral exemptions that are there for good reason, everybody else will have to quarantine in a hotel for the 10-day period. Now, why are we doing that without distinction between different countries? It's because when we're faced with new variants, we don't know what countries' variants might already be in, because not all countries do really extensive genomic sequencing. So just because we've got a South African variant and we don't think, or we don't have evidence that that variant has reached a country on the other side of the world, we don't know for sure it hasn't. So we need to take that comprehensive approach to give maximum protection. Now, we obviously can decide to do that, and we have decided to do that for people coming directly into Scotland, so flying into Glasgow, Edinburgh, Aberdeen airports. That will be the situation. It is much more difficult to do that for people coming into Heathrow and then coming to Scotland if the UK government is not imposing the same position. So that does remain under discussion. I took part in a Four Nations call last night where I raised again the concern that the UK borders as a whole are, forgive the non-technical term here, for my liking, still a bit too leaky to protect properly against importation of this virus and new variants of it. So we are still trying to persuade the UK government to impose the same kind of restrictions that we are doing, and then that takes away that problem, because it doesn't matter what airport you're coming into in the UK, you're subject to the same quarantine arrangements. Short of that, we are still discussing how we can best deal with the situation where somebody comes into Heathrow and their ultimate destination is Scotland, and there may be a combination of things we have to do. Agreements with the UK government, and also asking the police to do more than they are doing right now in terms of the checks coming into the country. So that is still under discussion. The last point I'd make here is this: nobody wants to be doing this. I don't like borders in terms of restricting travel for people. I'm an internationalist. I want people to be able to travel freely. But this is a public health crisis, and one of the biggest threats we face as we get the virus under control domestically, as we vaccinate against it, are new variants that are more infectious, potentially more serious, and potentially, at least for a period, reduce the efficacy of the vaccines. So that's why we need to be really careful about this. And so, ideally, we'd have the same arrangements across the UK to avoid these vulnerabilities and these leakages. But I can only take decisions for the Scottish Government. I can't force the UK Government to take similar decisions, but I can continue to try to persuade them, and that's what I will seek to do. Do you want to say a bit more about why border controls at this stage of the pandemic are so important?
So just really to add that this is based in the science, this is based in the evidence. There's been published evidence specifically from Scotland about both the first wave and the second wave of this pandemic, which shows that we had multiple infections coming in from abroad in both of the first waves and the second waves, and also multiple infections coming into Scotland from across the UK common travel area, and that these have seeded the pandemic within Scotland. So, we have good evidence that this has contributed significantly to both our first wave and our second wave. We'd be very unwise to ignore that. And we can reduce our community transmission and our community prevalence throughout Scotland as much as we like. But if we allow lots of other infections to come in from elsewhere, then you can see that just adds to the pool and increases community transmission again. So really, we have to take this precautionary principle and do a proportionate amount of things to try to prevent that ingress of infections, because we know that is a significant contributor to both the first and the second wave in Scotland, and that's just the science telling us that.
Thanks, Nicola. Peter McMahon from ITV.
Thank you very much, First Minister. First Minister, ITV Board has been speaking to young carers in rural communities who say they face additional pressures because of lockdown. One young adult carer we spoke to told us she'd been diagnosed with depression. She was doing everything for her mother but she worries that, she could bring COVID into the house. Now, carers groups have also told us that young carers feel, and I'm quoting, isolated and lonely, and people are, quotes, reaching crisis more quickly. Now, I know there's help from the Scottish Government, and I know there's help from local authorities, but is there more that you can do for these people who are caring for people amid the COVID pandemic?
Yes, I suspect there will be, and given that the question has been raised and it's a really important question, I will take this away from the briefing and talk to people in the government about what more we can do. Over my years in government, have interacted with lots and lots and lots of young carers, and put COVID to one side for a moment. The pressures that young carers deal with and face in their day-to-day lives are immense and difficult, and impinge on the normal enjoyment of life for young people in a way that most young people don't have to think about on their daily basis. And I both, in normal times, feel heart sorry for what many young carers have to deal with, but also full of awe for what they do deal with. And every single young carer I've ever met is genuinely an inspiration. But add COVID into this mix for all of the reasons that you've just talked about there that I won't repeat, and an already difficult situation, it is not hard to see how that could become almost intolerable for young carers. So yes, there's lots of different ways that we try to help and have pre-COVID and during COVID tried to help young carers. I'm not sure we'll ever get to a stage where I could stand here honestly and say we're doing enough, but we will strive to do everything we can. And as I said at the outset, I will specifically go away from this briefing and look to see whether there's more we can do. And in doing that, we will have engagement with young carers and their representative organisations as well. So if you can pass my thanks to those that you've been talking to, both for what they do, but also for ensuring that this is a question that is raised in the briefing today. Nicola.
To that as well, if I may, First Minister, we've always been very clear in Scotland that we believe that young carers should be prioritised for the vaccine along with adult carers. And although that doesn't directly address the mental health issues, it does show that we really value this young population, and also that we want to protect them as best we can. And the sooner we can get them vaccinated, then the sooner they can hopefully have some degree of comfort from that in terms of the risk that they might feel that they pose to the person that they're looking after. So that's one practical thing that we're doing. I think the First Minister is absolutely right. We can always do more, but within our mental health transition and recovery plan, which we published in October, we outlined a number of increased support and services in terms of mental health, and particularly for children and young people, and we'll continue to work towards those. But obviously young carers are a really significant and really important subgroup of that, children and young people with particular burdens and particular reasons for having poor mental health. So I would agree we can always do more, but we are very aware of the problems in terms of mental health for children and young people across the board as well.
Thanks. Callum Clark from Bauer.
Good afternoon, First Minister. Just back to quarantine. In response to Andrew's question, you spoke about potential agreements with the UK government. If nothing changes from the UK government's point of view, could you be forced to scale back your own plans? And secondly, on penalties being considered, do you have any update on that? And do you believe that the possible prison sentence being imposed by the UK government is inappropriate?
We won't scale back our own plans if we can't persuade the UK government to introduce similar plans, and it's entirely their prerogative to make these decisions. I'm not trying to be critical here. We just have a difference of opinion on this, which is fair enough. But if we can't persuade them to emulate us, then we'll continue to do what we plan to do. It will just be we have more of a sort of backdoor vulnerability and more of one than we would like to have. So that's the reason. In terms of penalties, we have the sort of fixed penalty notice arrangement for many of the COVID regulations that are in place, but ultimately it is open to the police to impose a charge for dangerous and reckless conduct if they think that somebody's breach of those regulations merited that. And that, of course, would have penalties that are much greater than anything you see under the fixed penalty notice regime. But ultimately, I've been a great believer all along, and, while you get exceptions and you get people who, for whatever reason, don't abide by regulations, and I know that's frustrating for those who are, by and large, most people are doing the right thing for the right reasons, not because of a fear of prosecution, but because they know that by doing the right things, they protect themselves and their loved ones. And I think that's what we still want to encourage as far as we possibly can. Jack Foster.
Could the prison sentence be a possibility then in Scotland?
That would be for courts. If somebody was charged with dangerous and reckless conduct, I don't impose prison sentences. That is for courts to do. But again, what I would say is, I think most people are following the rules for the right reasons, and that's what we want to continue to encourage. Jack Foster from Global.
Good afternoon, First Minister. It's 4 days until the hotel quarantine for international arrivals comes into effect. We've spoken with airports who say they still aren't sure how it's going to be implemented or exactly where the venues will be that people will be asked to quarantine. We also understand that crucial contracts with hotels still haven't been signed off. Now, that may well have changed this morning. I'm not too sure. Perhaps you can correct me on that if that's the case. Given the cost that's being posed to travellers who are now able to make those bookings, can they be confident that everything will be in place by Monday? And I also wondered what your response is to the National Union of Students who are calling for an exemption for international students, most of whom, it's probably fair to say, the £1,700 plus would be a considerable sum.
I understand why any group, and we're talking about students here, want to be exempt from these regulations, but the more exemptions we have, the less effect these rules have. We're trying to stop viruses, variants of the virus and the virus generally coming into the country. So we need to make that as tight as possible. We already have some potential vulnerabilities because there's a difference in approach from the Scottish and UK government right now. So we've got to be careful we don't undermine the very purpose and objective of this policy. We are, and Michael Matheson set this out earlier in the week, we're going to have a welfare fund to help anybody who is in genuine need and can't afford the payment to help there. But the other point I would make here is that this should only be for a very, very small number of people, because people, by and large right now, should not be travelling unless it is essential. And that's the most important message. In terms of the accommodation, the contract will be signed off soon. I hope I'm not aware of it having been done this morning. I don't know. I don't have it in front of me right now, but I was looking yesterday at the hotels that are going to be used in around the Scottish airports. That remains commercially confidential until contracts are agreed. So yes, I am confident that this will all be up and running and ready to go on Monday. Craig Payton from PA.
Thanks, First Minister. Danny Boyle from Bemis Scotland said this morning in the COVID-19 committee that there may have been some issues with certain groups on vaccine uptake. He mentioned examples such as asylum seekers that might be wary of government correspondence and that there might be an anti-vaccination stance among some people of Eastern European descent. Is this something that you're seeing in practice, and what is being done to ensure that everyone comes forward to be vaccinated? And just to follow on from Callum Clark's question, does the UK's more lax rules on quarantine undermine Scotland's rules? If someone could just fly to England and drive across the border, surely that will have an effect on Scotland in terms of the importation of the virus. And I was just wondering as well, how receptive has the UK government been to requesting conversations with the Scottish government about tightening these rules?
Look, I don't really think I can say any more than I have done. They haven't decided yet to emulate our decision. Whether they will in future, I don't know. And I don't think I can say any more than that. I'm going to not, rephrase a question to align with your an answer to align with your question, which gives a more sort of dramatic headline of, Sturgeon accusing UK government of undermining effect. That's not, obviously, given the geography of England, Wales and Scotland, part of an island, then these restrictions will be more effective if they apply right around the perimeter of the island. But short of that, we have a duty to do everything we can. But I respect and understand that each government in the UK has a duty to take the decisions it thinks are right. There will be decisions the Scottish Government takes that the UK Government doesn't think are right, and vice versa. And, you know, that needn't always be a sort of political, argy-bargy. We try to respect each other's decisions and work with them as much as we can, while persuading each other to do the things that we all think are right. On your question, I'll ask Nicola to say a bit more about the importance of vaccine uptake and also some of anything that we do know about variable uptake in different groups. I'd say two things from this. I didn't hear Danny Boyle, who's somebody whose voice in these matters is hugely respected. I didn't hear him at the COVID committee, but I'll ask officials to engage with him to understand the point that he was making. It wouldn't surprise me if there were some groups that are more reluctant perhaps to come forward, not because of vaccine scepticism, but a whole range of different factors at play, and we need to work to overcome that. But overall, the levels of uptake that we are seeing suggest much higher uptake levels than we see in other vaccination programmes. So I think there is a lot to be positive about here, but no room for complacency. We want everybody who's eligible for this vaccine to get it.
Thank you very much, First Minister. So we know historically from other vaccination programmes and research that's been done that there are certain groups in the population who are classically more vaccine hesitant, if you like, or less sure about vaccination, and that can be people of a younger age. It can be associated with different ethnicities and cultural backgrounds, and there's also an association that's been shown before with deprivation and perhaps more hesitancy to take up vaccination. So we are very aware of that. We were aware of that whenever we started the COVID vaccination programme. The first thing is to say that we have a comprehensive surveillance programme in place to look at vaccine uptake across many different populations in Scotland, including those that historically, or in terms of the evidence, we might expect to potentially have slightly lower uptake. And that analysis is ongoing, but we have the ability to link vaccination status to things like ethnicity. And what we've done is obviously we have tried to target certain communities. So, for example, we have produced all of our information on vaccination in multiple languages. We are also engaging very readily with community leaders with particular expertise and particular closeness to certain communities and sectors of the population, really to get them to translate the messages perhaps that historically have not been so easily understood by some of these communities. And we're working very closely with the third sector as well. And what we really want to do is we want to understand from any individual or community who are hesitant about the vaccine what it is that they are concerned about. We really want to be able to address that, because in the end we want the highest uptake across all of the population. We really do. And certainly when it comes to ethnicity, we also know that certain ethnicities seem to have worse outcomes when it comes to COVID. So, you know, we have so many reasons for wanting to encourage particular ethnic populations to have confidence in the vaccine and to take up the vaccine to protect themselves and to protect their loved ones. And what we certainly will do is we'll continue to keep this under review and observation. If we get to a stage in the vaccination programme where we genuinely are concerned that there are still groups where vaccine uptake is not high, then we will look at that and do everything we can to turn that around, whether it's about communication, whether it's about taking vaccine to people to make it easier for them to get it, whether it's about holding webinars or education sessions to address people's concerns. So we want to work collaboratively with people who are uncertain about the vaccine. We genuinely believe that it is the right thing for the population and the best thing we could do to protect ourselves just now. And we fully intend to bring as many people along with us on that as we possibly can. But yes, we are looking at all of that data and adapting our programme as we go.
Thanks. Chris Musson from The Sun.
Hi, First Minister. You were asked on a previous briefing about whether holidays in Scotland were likely to be allowed this year. I think it was the week before last. And you said that if various conditions for suppression were satisfied, there was a possibility that breaks elsewhere in Scotland would be possible. Do you think holidays to the rest of the UK will be possible in a similar vein, or do you think people could be limited to Scotland? And just on the care home figure that you mentioned at the start, how confident are you that this 99.9% figure for care homes first dose uptake is robust? Because from the published data, we can see that it's based on an estimate that 100% of older care home residents is exactly 30,000 people. And this means that effectively you're saying that just 30 or so people are left to vaccinating in these older people's care homes. That's despite the multiple outbreaks and sick people, for example, that you've previously discussed could have prevented vaccinations. So rather than quoting to 0.1%, shouldn't you be quoting a much bigger range, or are you confident that this is indeed 99.9%? Thanks.
I'm confident that the figures are robust. I'm not, as a politician, and you know this well, Chris, I'm not, occasionally I perhaps err here, as all politicians do, and we get our knuckles rapped for it, but I'm not allowed to just stand up and quote statistics that I prefer quoting. We have statisticians that operate in terms of the code for statistics, that, you know, so statisticians will tell me if a figure I'm using is robust or not. Perhaps the most helpful thing I can do, other than me stand here saying I'm confident it's robust, is maybe get the statisticians to engage with you a bit more on the basis for that figure and why they think it is robust. Although, you know, as we've said before, we have made estimates for some of the cohorts. You know, if you take the health and frontline health and care workers, we think we underestimated that cohort. So if you look at the number we predicted for that, there's actually more people being vaccinated because turns out there are more people in that cohort. The over 80s in the community, we think we probably overestimated. So that's why when I give that percentage, I say at least, because we actually think there are probably fewer people in that cohort, which is why the percentage we're quoting is maybe a bit of an underestimate. I think it should be a bit more robust in terms of care homes, but there'll still be a degree of estimation. But I'll get the statisticians to engage with you a bit more just to see if they can give you a bit more assurance. What we do know is that the uptake is extraordinarily high in older people's care homes. We are also, and I want to be quite cautious about this, not least because statisticians would probably rap me on the knuckles if I wasn't, but there are early, and because they are early, I don't think we could say they are definitive signs of the numbers of people dying in care homes still far too high, reducing a bit. So if you look at yesterday's NRS figures, the proportion of deaths in care home, the reduction in deaths in care homes seemed to be of a bigger order than the reduction in deaths in the whole population. Now, that may not be definitive, and it may not be possible to link that absolutely to the vaccine. But what we do know is that the vaccine programme in older people's care homes has had extraordinarily high uptake. And in terms of the 99.9 versus 99.8 or 7, I'll get the statisticians to, as I say, engage to see if they can give you a bit more understanding of why we think that figure is robust. Nicola might actually be able to do it right now, and I'll hand over to her once I've briefly answered your first question. The honest answer to that is I don't know. Right now, I don't know for certain whether when we come to the summer, I'll be saying, yeah, you can have a holiday in Scotland. I'm pretty certain I'll be saying to you, don't go overseas when it comes to this summer. I don't know for sure I'll be saying, but it's okay to travel anywhere in Scotland. And I don't know for sure whether I'll be saying it's okay to travel elsewhere in the UK. If I was to try and answer that question definitively now, I would be just telling people something that I have no real confidence in. All I know right now is we need to continue to drive this vaccine to the lowest possible levels. We need to vaccinate people as quickly as possible, and we need to stop the virus taking hold again, either by coming into the country or having outbreaks and clusters that then quickly seed more community transmission. And if we all focus on that, there's a greater chance that I'll be saying, yes, you can have staycations in Scotland and maybe in other parts of the UK in the summer, but I can't say that for certain right now, and I think it's only fair for me to be pretty open with people about that. Nicola, do you want to say a bit more about these figures?
Yeah, so I suppose the important thing to remember as well is that for any of the the estimated populations that we're talking about in terms of the vaccination numbers, it's a slightly movable feast because people move in and out of these categories, and it's the same for care homes. There will be people who will come in and out of that category as people move in and out of care homes. And so on any one day or any 1 week, it's going to be slightly different. But like the First Minister, I have confidence that our numbers are as accurate as we can possibly have them, given those caveats. What we do know is that we have very close contact with both our directors of public health and our local authorities, who, as you'll remember, throughout this pandemic have had really close workings with care homes for all of the reasons that we understand, because care homes have been so devastatingly affected by COVID. And there's a real absolute local drive within care homes and within the DPHs and the local authorities to make sure that everyone in care homes who can be vaccinated is vaccinated. So we know that. And we also know that if there are any pockets where there are large numbers, for whatever reason, of care home residents who haven't yet been vaccinated, we will be hearing about it. There have been outbreaks in care homes, and you're right, it's advised to wait until an outbreak has finished until care homes can be vaccinated. So we are taking that into account and factoring that. But our cases are coming down, and so that will be less of an issue as we go forward. And we've also allowed some flexibility in the timing of the second dose in care homes, again for that reason, to allow for the fact that there may be outbreaks that mean that it's better to do a care home slightly earlier rather than waiting. So everyone is absolutely committed to getting care homes done, and I think the figures speak to that. I think they do speak to the really high levels that we've achieved, and that's through the tremendous hard working of our vaccination teams on the ground, and also all of the staff in care homes and our public health teams.
Michael Blackley from the Daily Mail.
Thank you. Good afternoon. Just to pick up on Chris's question, yesterday the Transport Secretary had indicated that the international travel restrictions might need to be in place until the vaccine is rolled out domestically and internationally. Does the same potentially apply to cross-border travel restrictions? Do you think they might be needed until we fully roll out the vaccine in Scotland and other parts of the UK? And also, just in terms of your advice to families just now, should they currently not be booking summer holidays in Scotland, the rest of the UK and abroad?
I've forgotten my crystal ball again today, unfortunately. It is possible that we will need to see many of these restrictions, hopefully not all of them, and I'm not talking here just about travel restrictions, I'm talking about the overall restrictions, in place for quite some time to come, until people are vaccinated in greater numbers, until we've got much greater understanding of the impact that vaccine is having on transmission. So I can't rule that out. Equally, I can't stand here and say absolutely that is the case. I've tried to be very open and candid about the inherent uncertainties that even a year into this we are still dealing with, and to explain and set out our latest thinking as clearly as I can as we go along, and that's what I will continue to do. But I don't have a crystal ball, and that, believe me, is a matter of as much frustration to me on a daily basis as it is to journalists asking me questions that I know everybody is desperate for answers to. And in terms of my advice to families, I cannot give bespoke advice to every family about every personal family decision across the country, and I wouldn't assume to do so. I can only give you my best judgments about things from the perspective we're in just now, and give you as much information as I can to guide the decisions you're taking. Now, what I'm about to say today, because of the uncertainties, I can't guarantee won't be different in a month or 6 weeks' time in either direction. But right now, today, I would say to people not to book foreign holidays, not to book travel overseas because of everything we've talked about and the risks of importation with new variants in particular. And I would say to people, just be cautious about booking holidays even domestically. I want nothing more than to say to you, go and book staycations, because I want to support the tourist industry. The minute I think I can do that, I will be doing that. If you want to do that and take the chance that it will be okay, that's not for me to decide for you. But I can't guarantee to you right now that if you book a holiday, even at home, even in another part of the UK, I can't give you 100% guarantee that by the time we get to the date of that holiday, everything will be okay for you to go. I know that's not the kind of definitive, straightforward, 100% advice that people really crave. I know that, but it is the best I can do for you right now. If you want to err on the side of caution, then hold off a little bit. If you want to take the chance and hope, because we all hope that staycations will be possible in the summer. If you want to take the chance, then fine. But I'm just trying to give you my best estimates of where we are and where we might be, and where necessary, tell you what I can't absolutely guarantee. Okay.
I think all the scientists and the clinicians across the UK are saying the same thing. It's too early, and we just don't know. And it's important that we're able to say when we can't be certain about something and when we don't know, because we are in a rapidly changing situation, both in terms of the effect that the vaccine might have on transmission, which we are still very hopeful about, and which there's some emerging evidence to suggest that there could be a good effect of certainly the AstraZeneca vaccine on transmission, but also because we've got the variants in the UK now as well, and we just don't quite know yet how those variants might or might not spread. So even within the UK, if we're looking at booking holidays outside of Scotland, we just don't know yet how those are going to play out. So it is an uncertain time. And of course, it's a global pandemic. And so if you're talking about overseas, then it's even more uncertain. Because as we mentioned earlier, lots of places don't do genomic sequencing, so we don't know what the situation is with variants abroad in many places yet. So it's a very difficult time to try to plan. We're all hopeful, of course we are, but and I mean, I'm a clinician, I'm probably the last person to give you travel advice, but my travel advice would be if you're booking anything, even within the UK in the summer or the autumn, make sure there's a refund clause on it, because you may need to cancel that. And that's what we've all had to do over the last year, and we may still have to do that. So I wouldn't invest money that you couldn't get back at this stage, because no one at the moment can predict that future.
So none of that is what people want to hear, I know, but we've got to be frank. The term you've heard me use quite a lot if you've been watching these briefings in the past few weeks, and you will hear me use a lot more in the weeks to come, is trade-offs. We're not going to be able to do everything we want to do, so we're going to have to probably decide over the next few months what are the things that matter most to us. If we open our borders and all go on summer holiday and bring the virus back, we'll find we're pretty quickly living under strict lockdown again, potentially. So we have to decide, is it worth it to say, okay, we're maybe going to forgo the overseas holiday this year, but in return for that, we get the kids in school and can keep them in school. We can maybe get to see older relatives again, even if it is still in limited numbers and there's still some restrictions about it, but we're not all confined to our own homes. Is that the trade-off that we think matters? And that trade-off sort of concept is one that I'm going to, by necessity, have to be talking quite a bit about in the weeks to come, and I would just ask people to bear that in mind. I do get a bit, I kind of scream inside sometimes when I read headlines, and I'm not criticising the media here before anybody in the media assumes I am, but I do kind of find myself getting a bit frustrated when I see headlines like summer holidays are on or summer holidays are off. We have to see this in a broader canvas. And decide if going on overseas summer holidays is what matters most to us, then fine, but we then have to understand what the implications of that are. And if actually it's the things at home, seeing our loved ones, making sure our kids are getting some kind of normality, if that's what matters most to us, as I suspect for most people it is, then maybe just a bit more sacrifice on the holiday front for a bit longer is what we're going to have to put up with. None of us like any of that, but that's the reality we're living in just now. Tom Martin from the Express.
Hi, thank you, First Minister. A couple of things, if I may, just probably picking up a bit on this travel theme. This morning at the COVID-19 committee, Dr. Andrew Buist from the BMA was saying serious consideration should now be given to vaccine passports, given that individual airlines and even other countries are starting to look at this. So I was just wondering what your latest thinking is on that. And secondly, if I may, in the past week, we've seen Sir Elton John and Michael Caine promoting the vaccine south of the border. I know in December we were talking about the possibility of Sir Andy Murray here maybe being brought in to the campaign. Any update on your own plans for vaccine ambassadors?
Not at the moment. I mean, we will, of course, use people that we think are powerful advocates as and when we think that's appropriate. Andy has been mentioned. I always feel slightly guilty talking because, you know, he might, you know, have different views on this. He's somebody, of course, would be, you know, just because of what a great athlete and great all-round human being he is, he'd be one of the kind of people you would want to be doing that. But obviously, when we get to certain stages, we'll consider that. Right now, and I don't want to sort of dismiss the importance that might have at some stage, but right now, our experience so far of this vaccine programme is people don't need any encouragement. People are actually, the frustration is that people are not getting vaccinated quickly enough. People in the last week have braved the worst snow we've seen in Scotland for years to get to vaccination centres in huge numbers. So we don't really have a problem at the moment with uptake. But of course, we can't be complacent about that. So we'll consider to continue to review that. On vaccine passports, I've been engaged in other meetings and discussions this morning, so as is usually the case on a Thursday morning. I've not seen the COVID committee. On vaccine passports, my views are as they were when I last spoke about this in Parliament. I think it's too soon to say categorically one way or the other. There are a variety of ethical and equity issues there, but right now there are some practical considerations. We don't yet know how effective this vaccine is or these vaccines are in terms of reducing transmission. So it's just too soon to know what might be possible there. I know the WHO is already looking at some of this and no doubt will give advice in due course. You know, having, I suppose, the equivalent of the kind of yellow fever certificate, is that something we could foresee in future? Possibly, but we just don't know enough yet to be able to say that with any certainty.
So vaccine certification, we're all discussing it, aren't we? And rightly so. It's the right thing to discuss it, to see where the gaps are, to see how we might move towards that once all of those gaps are filled in and all of the ethical issues that you've mentioned are ironed out. We don't know real-world vaccine efficacy yet, especially against some of the new mutations. We also don't know when the vaccine's effective, how long it's effective for, and therefore how long could you have a vaccine certificate for. So we also know, of course, that no vaccine so far is going to give complete 100% protection. So how good is good enough for a vaccine certificate? And then, of course, we know that certain people can't have the vaccine for medical reasons. So where does that place them? As well as the fact that some people will get the vaccine before other people. So can they go off and do things that people who didn't get the vaccine yet can't? So until all these issues are really bottomed out and properly dealt with, it is too early. But we are not burying our head in the sand. We are engaging in all of those discussions at the UK level and the international level on those. In terms of people to support our vaccination programme, I can't believe we think we need celebrities when we've got myself and the First Minister standing up here on the stage, but apparently we do. Andy Murray might be a bit young yet, because I'm presuming, I don't know him medically, but I'm presuming he'll be way down the list. So perhaps we should speak to his mum about it. But in all seriousness, anyone who can help us to get the message across about the vaccination and that it's a good thing for the population, we would of course embrace that. And you know, as medical professionals, we have a number of fabulous people who are heading up the vaccination programme for us as well. So all help gratefully accepted.
Anyway, I think doctors will always be good advocates for these kind of things. Politicians maybe less so, but so you can have that, Nicola. Maybe not this one. I think we should probably stop on that front at the moment. Elsa Meishman from the Scotsman.
Can cases are dropping, thankfully, in most areas of Scotland, but in Falkirk and a couple of other areas of NHS Forth Valley, that doesn't seem to be the case. I wonder if there's any particular reason that's been identified for that and how much of a concern it is.
I don't have any particular light I can shed on Falkirk in particular right now. We will, I think, as we have known and learned from our experience, you will get regional, local variations from time to time. It's very rarely the case that there is a uniform. I don't know that we've ever had a case where there is a uniform picture across every part of the country, but I'm not aware right now of any particular issues in Falkirk, and I'm looking at Nicola to see whether she does.
I'll come in a second, don't worry about the general principles here.
So if there are particular issues, maybe particular outbreaks, we'll get that information to you. We want to see case numbers fall in every part of the country and to do it as quickly as possible. We are very encouraged by the trends in the data right now, but again, just a word of caution, case numbers, and I'm talking nationwide at the moment, are coming down, but they are still, and I think I'm probably still right in saying this, they're still higher than they were in December before Christmas. So we still got a way to go, which is why we all need to continue to stay at home and do all the right things. Nicola.
So we're doing quite a lot of work on this at the moment, in fact, looking across different boards in terms of their case numbers, and there are a number of different boards where cases are coming down faster than others. So it's not just a question of it being one board, actually. One of the things that we're looking at is the new UK variant, so the one that is more transmissible, but we believe that the vaccines are still highly effective against. And because that's more transmissible, it does look as if that particular variant takes longer in terms of the time for case numbers to come down. Now, across Scotland, the vast majority of our cases are now that particular variant. It's about 80%. But there may be differences across different boards in terms of the proportion that have that variant. And so we're looking at that very carefully, because that may be a reason for things coming down more slowly in certain boards. The other things, of course, are in relation to urban or rural populations. Again, the new mutation virus being more transmissible means that if people are more together in terms of populations in urban environments, then it may be that cases take much longer to come down because there's more opportunity for transmission, even within the restrictions that we have at the moment. And the other thing, of course, is that we have a number of community targeted testing programs at the moment, which are going out actively looking for cases. And so we certainly are seeing cases being picked up by that community targeted transmission, and we're hoping to be able to publish some information on that in the near future. And that's what those are designed to do. We've specifically targeted places to try and pick up cases, but what it does mean then is sometimes it slightly skews your case figures, because you pick up cases that you wouldn't have done otherwise if you weren't out there looking for them. So there's any number of reasons why there are differences across the board at the moment, and as I say, all of those are under analysis as we speak, but the good news is that they are coming down everywhere. They may be coming down slowly, but they are coming down. And if there's anything else, obviously, that we need to do as a result of that analysis, then clearly we'll take that action at the time.
Mark Faulkner from the Times.
Thank you, First Minister. Matt Hancock on GMS this morning said effectively, if I want to fly to Spain and back from Newcastle Airport and drive home to Edinburgh, I have to follow his advice and quarantine at home, and not follow your advice and pay at least £1,700 for a quarantine hotel. If I was a selfish person, that would sound like a good deal to me. So what would you do to stop me? And how would you prosecute me, given that the minister and the government that controls the borders says to listen to him and not listen to you?
I'm going to not engage with the particularly provocative way you've asked that question, because I know what headline you're trying to get. But we can only impose these quarantine restrictions on people travelling direct to Scotland. The reason we want the UK government to impose the same restrictions for England is that means anybody coming into Heathrow or any airport in England would have the same restriction. And to be clear, for somebody who lived in Scotland, that wouldn't mean travelling all the way back to Scotland and then going into a hotel, because you kind of defeat the purpose of managed quarantine if you've travelled halfway across the country before you quarantine. That would mean going into quarantine at the airport you arrived at. So in a sense, what you've just described to me there, if somebody is travelling from, I didn't actually hear Matt Hancock directly this morning, from Newcastle to Edinburgh before they decide whether they're going to quarantine at home or in a hotel, they could have infected lots of people on the way. So that's kind of defeating the purpose of the managed quarantine anyway. That's why we're trying to persuade the UK government to see if we can have a uniform position across the country in order that these issues don't arise. Dan Sanderson from The Telegraph.
Thanks, First Minister. Yeah, can I just follow up on that? So I think you and Michael Matheson have been clear that, you know, short of the UK government agreeing to your position, which for what they've said they're not going to do, you want the UK government to identify Scottish residents coming from non-red list countries and put them into a hotel in England. So is that, you know, is that still something you're hopeful of getting an agreement on, or have the UK government said they're not going to do that? And also, you said earlier in response to the BBC, if there's not an agreement in this area, you might be asking police to do more than they're doing right now on the border. Can you just expand a bit on that? You know, could we be talking about a sort of hard border with everyone coming across the roads being checked, or would it just be more, you know, a greater presence and patrols? Thanks.
No, I can't, and I won't expand on it for two reasons. Firstly, we haven't taken those decisions, so I would just be speculating, and secondly, actual enforcement would be a matter for the police, so I would probably get the Chief Constable to stand here and talk about that. On your questions, I've done my best to answer these questions several times, but I'm only responsible for Scotland. I can't take decisions that apply for England. So can I suggest, and I don't mean this facetiously, and I don't mean this in any sort of pejorative way, but go and ask these questions of the UK government. Ask them whether they're going to change their position to make it match Scotland's, or what they think the weaknesses are if they don't, and what they think the practical solutions are if they don't. Because, you know, it's their answers to these questions that will determine how far we can get in fixing this. I can only make these decisions for Scotland, and I will try to persuade the UK government to do likewise. But the reasons why they're not, or the likelihood of them doing it, these are questions you have to ask of them. So perhaps if I can politely suggest that you maybe could do that and see what those answers are. I think that concludes the questions for today. So my thanks to all the journalists, my thanks to Nicola for helping me answer the questions, and to Yvonne for BSL interpretation. And lastly, thank you to all of you. We are seeing lots of signs right now that give us a lot of encouragement and optimism, both on the suppression of the virus, in the suppression of the virus lane of the race that I keep speaking about, and also in the speeding up of the vaccine lane of the race. So, you know, there's lots for us to feel hopeful about right now, but we need to stick at it on both of these things if we're to see this progress continue. So please continue to do that. Thank you for coming forward, those of you who've been invited so far in such huge numbers for vaccination. If you're getting invites over the next period, please make sure that you come forward so that we can keep up this progress. But also, please play your part, still play your part in slowing down the virus by staying at home. Staying at home is protecting the NHS. We see that in the figures. And while the numbers of people dying are still horribly high, we will start to see that come down as well. And so the staying at home will start to save lives as well. So thank you to everybody for doing that. The Health Secretary will be leading the briefing here tomorrow at 12:15, and I will see you again at 12:15 on Monday. In the meantime, thanks very much.